in the recent, we've always heard a lot about breach in security, breach of leakage of data.
Yes.
What about AI in healthcare? Is there always a chance of any leakage of medical data,
Yes.
private medical data?
Yes, there is a chance because when we are feeding the data sets to AI, humans are doing it.
Right.
So humans is the weakest link in this chain. So definitely there could be a breach of data, and you need to have a lot of fail-safe procedures, standard operating procedures. To a patient data breach is very common, and in dark web there are people who sell these patient data. So insurance companies can get your confidential data. So it's a possibility, and it is very much real. Yes.
We have our National Indian Medical Association, which is the main regulatory body of our medical profession. What is their perceive? How do they perceive regarding AI, or are they willing to accept?
The thing is, AI-based treatment and AI-based diagnosis are not approved in our country yet. Okay. Because as I told you before, you need approval from a regulatory. For example, if it is a drug thing, if it's a new drug by AI, you need require DCGI approval, Drug Control Committee of India, Center of India. So right now in India, there is no AI approved treatment or AI approved diagnosis. So it is a future. So it will come, and I feel NMC and IMA they will be having their own standard operating procedures for it.
It is the need of time.
Yeah, it's progressing because medical AI in India is progressing. But we are in the beginning stage. We are in the infant stage. But when it becomes mainstream, definitely there will be.
So, in your regular practice, do you have patients coming to you with already pre-fed AI diagnosis?
Not yet. Not yet. But it's going to be common. Okay. Yeah. Initially it was Google. Now it is ChatGPT. So it will be a common occurrence. Going to be a common occurrence. And but we won't ignore them. We won't ignore their diagnosis.
We won't, or we can't?
We won't.
We won't.
We won't because just because it's an AI thing doesn't mean that you should ignore them.
Okay.
So when patients come to you with the Google diagnosis, they can ask you questions whether it is this. You should be able to substantiate them, whether it is right or wrong. I mean, it's a diagnosis. Right. You can't just put them away. Okay. They can be right. We can be wrong. So we should be wise enough to say that we are wrong and they are right. At the same time, we should be wise enough to disprove them or ignore the diagnosis because it doesn't have any basis.
Right.
So science is science. We can be wrong too. As a doctor, you can be wrong.
But in our current generation, we are all filled with a lot of ego.
Yeah.
So what should our current or upcoming generation of doctors understand, or what should they foresee in the future in regards of AI?
Yeah, in regards of that's where the AI comes up. So AI till now don't have ego.
Right.
So that is where AI can accept that it can be wrong, it can be right, provided the data given to them is good enough. It's kind of like a garbage in, garbage out, just like what we used to say about the computer. Right. So, but when we say a human versus AI, the problem comes. There are a lot of biases, by human biases.
Right.
So there could be ego. For example, even there are doctors who don't. I mean, there are doctors who don't know certain things that is newer advances. So advantage of AI is that when some new medical data, new research is happening yesterday, they can get updated.
Right.
It's a common database all over the world. Humans, they require some time. There is a latency. So I think AI can take off those latency in having it. And people say as you grow older, you become more wise, and the knowledge is not just a thing. But we can actually break down the wisdom into simpler things, and AI can become more wiser than human. So people don't have an explicit definition for wisdom.
Right.
They just say people become wise as you become old. That is their own individual experiences. Okay. What if the experiences of thousands of people can combine into a single database, and that makes the AI better? So the point where the human doctors realize they can be wrong, that could be a start of a new thing, and that is one of the field where AI can become superior in treating a patient.
Talking about superiority,
Yeah.
What one patient looks at a human doctor is they even look for empathy. They look for soft skill communication.
Yes.
Can we expect that from an AI?
Yes, there are emotional AIs being developed.
Okay.
There are AIs that can talk to the human emotionally,
Right.
and they are developable, and they can be more empathetic than a human ever can be. So it is under development, and there is a myth that AI is blunt, because they have been shown in movies and popular media that they are very blunt in talking to people. But there are emotional AIs that have being developed that can be more empathetic to humans. And emotional AI is another branch of AI that's trying to be more empathetic. So you learn to be empathetic when you learn as a child, as a teenager, and when you meet people and you feel the emotions by yourself, then you become empathetic.
Right.
And there are, of course, psychopathic humans among us too.
Right.
Okay. There are doctors who have no empathy too. So AI can develop feelings and emotions, and there are AIs actually. There are emotional AIs already. So it's just a matter of time. Actually, they could be really good in patient care also.
Right.
Yeah.
What is the role of new drugs co-founded by AI?
So AI has become really good in drug discovery.
Nice.
For example, 4 years back in 2020, a new new antibiotic called Halicin was being discovered by AI.
Mhm.
Because it's called Halicin because there's a movie called 2001 Space Odyssey. So it's named after that movie. So
Nice.
Halicin is an antibiotic because in 2017, WHO has already declared that we have reached the post-antibiotic era.
2017.
We have already entered the post-antibiotic era. The most of the antibiotics have become resistant to a lot of bacteria.
Okay.
So the need of the hour is to get more antibiotics. So when you consider in 1928, Alexander Fleming discovered penicillin notatum.
Mhm.
So you remember serendipity
Right.
was being said. So he requires a prepared mind. So penicillin was a fungi, and the penicillin notatum fungus compound was being found. And just like that, a few years later in 1944, streptomycin was being found. So the discovery of newer and newer antibiotics takes time.
Right.
So that is being cut short by AI. So in 2020, Halicin is the first antibiotic discovered by AI, and it is actually a new mechanism of action. It changes the electrochemical gradient of the cell membrane, and it affects a lot of bacteria. So it kills E. coli mostly.
Okay.
So in a few years later, you heard of this very resistant superbug called Acinetobacter baumannii. So a new antibiotic again was discovered for that, called Abusin. So the advantage of Abusin is that it's a very narrow spectrum.
Mhm.
It only kills Acinetobacter.
Oh, very
So,
focused.
Yeah, so it doesn't kill any other natural bacterial flora. So it is more safer for humans also. But again, all these things are under drug research.
Mhm.
So AI has helped. It helps through thousands and thousands of molecules. By machine learning model, it analyzes thousand and thousand molecules in silico in computers,
Okay.
and then up to some 200 molecules were predicted. And from these 200 molecules, 9 of them were discovered,
Mhm.
and 1 of them were potent enough to kill Acinetobacter baumannii.
Okay.
And they work in a mechanism of lipoprotein trafficking. So AI has become really good in discovering molecules.
Right.
And the molecule which they found for killing Acinetobacter baumannii was actually made as an anti-diabetic drug. So AI is creating hopefully AI can extend the antibiotic era, because it's already 100 years. It's just closing a century of antibiotics.
Right.
And antibiotics is one of the reasons why the lifespan of humans is increasing a lot.
Right.
So hopefully AI can do a lot in drug discovery.
So talking about antibiotics, now we have a wide range of antibiotics from a cost point of view.
Yes.
Something which is very pocket friendly, ranging to something which is very expensive.
Yeah.
With these current evolvement of new drugs, what is the impact of the financial side on healthcare?
So as AI comes, the research and development costs can go down really good. I mean, it costs millions of dollars to create a drug.
Okay.
So that is why the medicines are expensive.
Right.
So then after 5 to 10 years, the patent goes away. After they recover the money of research and development of a drug, the drugs become cheaper.
Okay.
The drugs, when you say we need a new drug, it requires millions and millions of dollars to create a drug. So I hope AI can cut short by a fraction of those R&D costs of making a new drug.
Okay. Yeah. Now, in a country like India, or be it any country in the world, we have the economic strata. One, the very rich or the affordable. One, the very poor, and then the middle class. When AI which is already there, which class of people can really have an access to such technology?
It's a policy based thing, and it depends. So if you consider public health, if they, for example, WHO decided to open source, or they decide to make it a economically very viable machine learning model or AI model, it can be accessible to anyone.
Right.
Yeah. And just like an ATM, there could be an ATM for medicine services also. If a patient having a disease, just have to approach an ATM. ATM kind of a booth.
Vending.
Yeah, a booth. Yeah. Right. And the AI can diagnose and just dispense the medication. The entire human factor can be out. Okay, so that is one way of doing it, and it all depends upon the government policies. I'm not saying that can happen now, but that is the future. And human doctors will be slowly phased out. Then surgeons will be, as the advances in robotics is increasing, robotic surgeries will be more precise than human surgeons. So surgeons will also be phased out, because a robotic surgeon will be more precise, or a robotic or a AI based medical physician will be more precise than a human physician. So slowly humans, as a part of a traditional job, will be phased out from the medical care. So I feel depending upon the policies, it changes. Middle class, upper class, lower class, we don't know yet. It's a policy thing, so we don't know.
So Kurian, since you mentioned that doctors may phase out now, suppose if you want your child to become a doctor in the future, would you recommend or not?
If AI was not there also, I won't recommend my child to become a doctor. I mean, but again, it's my
personal choice.
It's my son's personal choice.
Right.
But being a doctor could mean different. 10 years from now, 20 years from now. Being a doctor in early 1500s was different. Being a doctor in 1800s was different. Usually barber shops used to be the doctors. I mean, a lot of elements used to be treated in barber shops way back in maybe 200 years back. So the concept of doctor itself can change, maybe in a decade or two.
Do you have a vision on what it could be? Do you have just a wild dream on what
a doctor? I think the profession doctor will be obsolete. Yeah, it will be obsolete, and it won't be there. Just like an ATM machine.
Is that scary, or is it?
It is more safer.
It is more safe.
It is more safer for the patient. It is more better for the patient, because there will be a time when patient will be asking, saying, "I don't need a human surgeon to operate on me, because human surgeon can make mistakes." It will come to that stage pretty soon.
So since we've understood a lot about AI right now, so for the current medical fraternity, what can they do to use AI as part of their career?
So there are people who are in the medical field who are learning MBBS, nursing, paramedical courses. So AI is definitely is going to be an important role in their career. So it's high time they supplement their courses, whether it's being an MBBS or a nursing, with an AI course. And learning AI is not that difficult, and there are lots and lots of courses, and there are a lot of online resources like Coursera. So there are a lot of online resources for AI, and being AI a part of their curriculum is very important, because stereotypical jobs, for example, a person takes MBBS, then they take MD, and then they take DM. Is going to be more stereotypical, and they won't get many jobs presently, because we are talking 15 years of career. So by the time, so now we are in 2024, and maybe 10 years to 15 years, we are in 2034 or 2040. And being a cardiologist from now used to be a traditional job way back in 1990s and early 2000s. But now the demand for such jobs will reduce drastically. It's already reduced drastically. And thinking MBBS, MD, and DM, or MS or MCH is not going to cut it for them in their career. So having a different job, they have to differentiate themselves, because next era is going to be an era of medical AI. So it's better they could supplement their courses with knowledge about AI and how can they use to differentiate themselves in their career. Because traditional stereotypical jobs like BSc nursing, MSc nursing, after some time the demand is going to go down, maybe in 5 years. So it's better they include AI in their own fields, and there are a lot of online resources, and there are classes, and they can improve upon it.
But there's still a learning curve. It's still on.
There is a learning curve, but presently the courses they offer online, the learning curve is very less.
Nice.
Anybody who would like to learn AI, they can learn AI. Only thing is the willingness to learn. Of course, there will be a steep curve, but that is going to be the future.
So, do you feel that this early learning of AI should be done at the earliest?
It is better if it's done earlier, so they could understand the concepts better. And unlike other fields, AI is a highly changing field. 3 months, within 3 months itself, AI field can change drastically. What we have seen AI 3 months back, what we're going to see AI 3 months later is going to be different. So if they could see the pattern of changes in the evolution of AI, it will be a huge boon for the students, and they could differentiate themselves, and they can stand apart. And having a job that is stereotypical is not going to cut it in the future.
Right. So since both of us being orthopedic surgeons, what do you feel I should learn to be a part of orthopedic AI?
Yeah. So as a part of orthopedic AI, you can learn how the chatbot works.
Right.
So how you can get guidelines for your treatment. For example, a diagnosis of a comminuted fracture radius, I come to you. So you can check for the guidelines through AI. So AI can pick up the relevant guidelines for the treatment of that patient. So that can improve, that can refine your treatment. Of course, there is a standard treatment, but AI can refine your treatment in the future. So if you can understand the process, how AI refines the treatment, you get a better understanding about AI. Because we have to be careful about the bias in AI, how it can go wrong. So we should understand both the benefits and the problems with AI. So a basic understanding of AI is a good thing in the general practice of orthopedics.
So sometimes what I understand from you is, suppose if we have a bad trauma, the AI would give us an image. Once if we feed the X-ray, and then the AI would give us the exact plan of treatment.
Not yet, but there are, for example, MedPalm 2 by Google is medical AI, but it has not been released to the rest of the world. It's only released to a certain domain of people in US. So we don't know yet. Such elaborate AIs are only coming up.
Okay.
But there are a lot of chest X-ray analyzing AIs that's been going around since COVID.
Okay.
Because analyzing chest X-ray has been a vital part of treating a patient with COVID. So a lot of chest X-ray analyzing AI models have come up. And
someone talks about retinal scan.
Yes. Again, retinal scan is another domain where lots and lots of AI models have come up.
Right.
And these will come up. Orthopedic AI is it's coming up, but the entire suite of treatment, not yet.
Okay.
Yeah, but it will come up. Yes.
So after this elaborate discussion, AI is the future.
Yes.
So I think every current MBBS or postgraduate students need to take AI as their friend and not as someone to ward off.
Yeah.
So
definitely.
Yeah. So thank you for giving us all these valuable inputs.
Yeah.
So I'll also learn a bit more about AI so that
I'm also learning. I'm just learning. I just started. I'm just an AI enthusiast. I'm not a professional yet.
No, I think you have given us very valuable inputs about the future.
Yeah.
So let us be aware and work together for a better future.
Yeah, definitely.
Okay. Thank you, Kurian.
Okay.
Thank you.
Okay.